Thank you. Hi, folks. Nice to be in community with everyone. I just want to introduce everyone to, my name is Adu. I am the Advocacy Manager over at National WIC Association, and I am here with PIF consultant Elizabeth, so from Protecting Immigrant Families Coalition. We are really excited here to just talk about at a very just the intersection of WIC and immigrant access, because we've been seeing a lot of anti-immigration bills, of course. And so we just wanted to give an overview of those two overlap that intersection. We're going to start off just quickly just with some federal updates about WIC, given the government shutdown just ended, and then I will pass it over to Elizabeth and then back over to me to talk about WIC state policy, some trends that we're seeing, and then what's next. But yes, please answer your questions. Please put your questions in the chat boxes as soon as you have them.
Hey, Adu, apologies. Quick comment. It sounds like the last session didn't end on time. So if we could maybe go back to the beginning really quick, and then we'll kick you off in just a minute. Sorry about that.
Oh, okay. No, it's okay. Go on mute.
I'm going to redo all of my opening script. So it looks like they're just wrapping up. So we'll start here in just a minute. Thank you to everyone who's joining us. We have a couple of announcements as everyone logs in. First, we are recording this session, and it will be available here in Excel events for the next 30 days and on the Alliance's YouTube channel after that. Secondly, if you'd like to ask a question during this session, please make sure and use the chat or Q&A area to the right of the viewing window. If you'd like to access English or Spanish captions or Spanish audio translation, please use the widget below this viewing screen or use the link we have dropped in the chat to access them in a separate browser window. Finally, this is a webinar type of breakout session. The speakers will not be able to see you, but they will be able to see your chat and Q&A comments in the panel to the right. So please feel free and use those throughout the session. So it looks like we are ready to get started. I am going to hand it over to our speakers to begin.
Thank you. Hi, everybody. My name is Adu. I am the Advocacy Manager over at National WIC Association, and I'm here with PIF consultant Elizabeth. Today, we'll just be talking a little bit about just some updates on WIC at the federal level, given the government shutdown. I'll pass it over to Elizabeth to talk about immigration benefits access overall at a high level, and then we'll go into the intersection of WIC access and immigrant families at the state level. But yes, please put your questions in the chat. We'll try to answer as we go, but most likely we'll answer all at the end. So I'm going to hand it over. Oh, no, it's still me. So just so folks, as folks know, Congress finally passed a bill to end the government shutdown. Since WIC is a discretionary program, it is subject to the annual appropriations process. So when Congress didn't pass any appropriations bill or a CR before September 30th, it led to the government shutting down, which began the crisis for WIC. And since then, there were 2 CRs that were under consideration, but neither had passed over the past 43 days. And so we're just really ecstatic that Congress not only reopened the government, but as part of that deal, passed a full year agricultural appropriations bill, was included in that bill, which is where WIC funding sits. The deal includes full year funding for WIC, which is $8.2 billion for FY26. It removed the proposed CVB cuts that were once proposed with the House bill, and then as well within the president's budget. And then it refills the contingency fund at the pre-shutdown level of $150 million. So we're really ecstatic about these things, and we're just waiting for the money to hit state stores. Just a little bit of an overview of the funding resources that were available to states during the shutdown. USDA had distributed the $150 million WIC contingency fund, completed the recovery and reallocation process, which gave about 141 plus $223 million out to states, and then completed another round of recovery and reallocation. The White House also dispersed the 300 million Section 32 funds, and then dispersed an additional 450 million, I want to say the past 2 weeks. And then states were also able to spend forward, which means they were able to pull up to 3% of the total FY25 funds to spend in FY26. States also utilized infant formula rebates, and they were also authorized to pull from state appropriated or general funds, which will be reimbursed. So these are just type of the funding resources that states were able to pull upon during this crisis. And just to talk about a little bit of the impacts, state and local agencies were continuously prepping, shutting off / furlough plans, and some state and or local agencies actually did furlough staff because they continuously were running out of NSA dollars. Some clinics were providing services without certainty of what program operations could look like in days to weeks. Families were confused, scared benefits may shut off. So there was an uptick of calls that clinics were seeing, and just families who were so fearful. And on top of that, with the SNAP funding disruptions, it pushed families to seek WIC benefits. And at the time, meaning available fund at the time would have depleted quicker than usual. So these are just a little bit of a high level overview of some of the impacts that we saw. Luckily, there was no widespread disruptions, but definitely case by case and state by state. It was just a different story for each state. So we're just really excited that FY26 funding is now secured, and we live to see another day. So now I'm going to pass it over to Elizabeth to talk a little bit about immigrant benefits access.
Sure. So hi, everyone. I'm Elizabeth Lower-Basch. I'm a consultant with the Protecting Immigrant Families campaign, and we work really on the broad range of public benefits that immigrants and their families use to meet their and their families' basic needs. So right in February, shortly after President Trump was inaugurated, he issued this executive order titled Ending Taxpayer Subsidization of Open Borders. And if you read it, it's all about people who aren't eligible for public benefits somehow accessing them, and how important it is to shut that down. It suggests that people without documentation are accessing benefits, which is not the case, and they have not been eligible for them for quite a while. But it really sort of set the tone of trying to discourage immigrants and their families from accessing a range of benefits. And this was followed almost immediately by a letter from Secretary Brooke Rollins at USDA, basically saying, yes, we're going to look at all our programs and make sure that no one who's ineligible is getting them. So again, lots of signaling. Next slide, please. And of course, this is just, I think probably everyone listening knows, this is in the context of immigration enforcement that really has many immigrants frankly living in fear about being out in public, taking their kids to school. This picture is of a raid that happened at a child care center, which is really horrifying. One of the specific policy changes that the administration did quite quickly is that they lifted what had been called the sensitive locations policy, which said that ICE should not conduct enforcement in social service, healthcare establishments, courts. So there's a lot of fear about, will ICE come to WIC clinics? Will it come to food distribution sites? Will people, waiting online to get food be picked up? So we do know that separate from the policies that directly affect access to benefits, that the overall context matters a lot and accentuates the concerns and chilling effect. Next slide, please. Again, this is also in the context of a range of restrictions on lawful immigration and lawful immigration statuses. dramatic cuts in refugee admissions, taking away temporary protected status from people who've had it for years, huge fees for H-1B visa petitions, but even new fees for applying for asylum. There's never been a fee for applying for asylum, and now there is. Anti-American sentiment in social media or activities can be a basis for denying a visa or a green card application. That's very vaguely defined. No one really knows what it means, although protesting in favor of Palestine seems to be one of the things that gets you on the list. And just overall delays in processing of applications. So people who are eligible for green cards are just waiting longer and longer to get them, which again limits their access to benefits. Next slide, please. These are some of the headlines. I literally just went online and found a few headlines and cut and pasted them. It's across programs, food programs, Medicaid, tax, which has always been like incredibly firewalled and protected from being used for any other purposes. DHS has been getting access to these databases, supposedly to look for fraud, but also apparently for immigration enforcement. And that has created a lot of fear. If I apply for benefits, will my information be shared with ICE? Unfortunately, sort of the practical advice is, at least for SNAP, like they've asked for data going back 5 years. So if you're already getting SNAP, like there's not a benefit to withdrawing your application or stopping receiving the benefits. And I will note that particularly Democratic states, blue states, have sued the administration to avoid having to share their SNAP data. And so far, that lawsuit has been effective. So not all states' data has been shared. Next slide, please. HR 1 is the mega bill, the omnibus reconciliation bill that was passed over the summer, and it sharply limits immigrant eligibility for SNAP, Medicaid, ACA, Healthcare, Affordable Care Act subsidies, and Medicare. These programs had already been restricted under a 1996 law called PERORA, the Personal Responsibility and Work Opportunity Reconciliation Act, had already limited benefit access significantly, but it had preserved access for most humanitarian immigrants, so refugees, asylees, victims of trafficking, groups like that had been protected. And HR 1 takes away eligibility from those groups. The groups that remain eligible, in addition to US citizens and nationals, are green card holders or lawful permanent residents, Cuban Haitian entrants, and COFA, Compact of Free Association migrants. So much narrower groups. The implementation dates across these changes vary, but for the SNAP changes, states were told on October 31st, one day in advance, that they were supposed to apply the SNAP restrictions to new applicants as of November 1st. Obviously, all sorts of other things were happening in SNAP in November, so that's a whole other mess, but those restrictions are starting to take effect now. And also the child tax credit was limited to children who have at least one parent with a work-eligible Social Security number. So in the past, as long as the child had a Social Security number, they could get the child tax credit, and that is not the case going forward.
Hey, Elizabeth, quick question on the chat. Someone's asking if we know how many states have capitulated and shared SNAP data?
It's slightly over half, I believe, is our understanding, although exactly what the data that was shared seems to not be the same across all states. So there's still some variation. But it's, I think, 20 or 22 states that were in the lawsuit, and our understanding is all the others have shared data. Also just flagging that the administration has really tried to cut access to these benefits, not through legislative changes, but through guidance, through adding grant conditions, in other ways, restricting access even beyond what Congress already did. I do want to flag that SNAP, WIC, and school meals, it's actually the guidance has really not changed very much, but it does say that other programs such as Head Start and public health centers are considered federal public benefits as defined in that 1996 law, and that means that they're limited to qualified immigrants. So folks without documentation would not be eligible for those if that policy took effect. I will note with Head Start, again, the courts have provided an injunction preventing that from taking effect. And again, some of the states with Democratic governors have also sued more broadly. Flagging again, immigration restrictions they've added to grant conditions for programs such as assistance for disaster relief or domestic violence support. Again, these have always been available without regard to immigration status, both because everyone needs them and also because in the middle of flood, people, even if they are citizens, may not have their paperwork with them in order to be able to prove it. So it's really quite horrific that they are trying to add these conditions. And as I noted, there is a lot of litigation going on. I can put in the chat a link to a Protecting Immigrant Families tracker where we try to keep everyone up to date on what's going on with this, because it's a lot of moving parts. Next slide, I think. Unfortunately, we expect there is more to come. Public charge was where Protecting Immigrant Families actually came together during the first Trump administration. It's a longstanding piece of immigration policy that says that people who are expected to be primarily dependent on government assistance can be denied admission or denied green cards. Historically, this has really been only understood to only mean cash assistance and institutionalization for long-term care. The first Trump administration tried to weaponize this and expand it much more broadly to include SNAP, to include Medicaid and some housing programs. We know that a new rule is with the Office of, or is not, it's clear it's Office of Management and Budget Review as of yesterday. So that could be published for comment any day now. We've also heard that they are looking at some of the provisions around sponsor deeming and sponsor reimbursement for sponsored immigrants. So that's typically like family reunification visas are under sponsorship, and they could be going after sponsors to potentially pay back benefits that people receive. I have links on the slide. I think the slides will be available later, but to people, to some of the toolkits that the Protecting Immigrant Families Coalition has put together on all these issues. So yeah, it is a lot. I'm sort of feel like I'm the bearer of doom in this conversation, but I do think it's important for us all to be informed about what's happening so we can work together so that families can continue to get the food and other supports that they need to thrive. And with that,
thank you, Elizabeth. And yes, the slides will be available to folks after the presentation. But thank you so much. This is really informative. And now I will be going into sort of NWA's entryway into state policy with WIC, and then also, of course, with this focus on immigrant families. Just as Elizabeth had mentioned earlier, the Personal Responsibility and Work Opportunity Reconciliation Act of 1996, just wanted to go into it a little bit further, was a major welfare reform law that emphasized work requirements, imposed time limits on benefits, and gave states more control through block grants. The law also restricted access to benefits for certain immigrants and aimed to promote family stability. And it's also known as PERORA. So While PERORA imposed restrictions on many federal benefits for legal immigrants, WIC was explicitly exempted, allowing states the option to continue providing WIC benefits to immigrants regardless of status. At any time, states could restrict benefits based on immigration status, and states can do so without legislation. And so that is actually a piece that we don't generally advertise. We are very thoughtful about how we share this because we don't want to give states ideas to take this up. So up until 2022, Indiana was actually the only state to have repealed restrictions. It was a bit they had restrictions based on WIC eligibility based on immigration status. However, these restrictions were quietly repealed in 2022, and the repeal was notably influenced by personal connections. So the Republican member who led the effort had a daughter-in-law that was a DACA recipient, so Deferred Action for Childhood Arrivals, and worked at a WIC clinic. So this discrete legislative fix resulted in the repeal of the policy without extensive public discourse. And so while Indiana was the only state to have done that until 2022, it's unfortunate that this year Idaho actually enacted restrictions in this year. And I'll talk about it a little bit in the next couple of slides, but NWA worked with state partners against passage, but it ultimately passed, and we're currently working on a repeal strategy. So I want to talk about a little bit of the trends that NWA saw in this past year. So there was definitely limited access to WIC for individuals who are not qualified aliens, such as the Idaho bill. There was bills of compelling state agencies to data share about program participation and costs for undocumented immigrants, and then there was bills criminalizing government staff who do not cooperate with ICE or immigration enforcement. So these are some of the trends that we saw in 2025 and preparing for in 2026. In the next couple of slides, we're going to talk about Idaho and Louisiana and just some of the bills that we saw in this past legislative session. So in Idaho, H135 removes prenatal care, postnatal care, and food assistance for children from the list of exemptions for which verification of immigration status is not required. Eventually, the age was narrowed, so the law applies to people 18 years and older applying for benefits for themselves. So, in the context of WICs, it would in fact pregnant people and postpartum people. NWA's involvement was informed by FRAC and their network. Their partners, I believe, testified against the bill. We were connected and worked with Idaho ACLU, mobilized partners such as Chamber of Commerce, dairy partners, and food/beverage groups. Unfortunately, the bill was still pushed through, even though we sent letters to state leadership opposing the bill. And so right now, it was signed by the governor on April 3rd, and then it took effect July 1st. So implementation is underway. We're monitoring impacts, and then we're also, again, beginning to develop a strategy for next session. In Louisiana, there were a couple of bills that were passed. So these bills address data collection, verification of immigration status of benefits, and enforcement. So basically all three of the trends that we were seeing across the nation, Louisiana had all three. Laws currently do not directly apply to WIC, so we're, again, working with local partners to monitor implementation. And I can also drop in the chat after this just a little bit more about each bill. So what's next? We're currently preparing for 2026 state sessions. As I mentioned, we're developing a repeal strategy for Idaho with partners, and then we're also really hoping to connect with folks based off of this call, and of course just other platforms that we're just engaging in state partners. We're trying to connect with as many state partners as possible to just connect and especially if you guys know of any upcoming harmful legislation. And then, of course, NWA also has a WIC state advocacy working group. So I'm happy to share with folks that meeting. And it's just for a place for us. We focus on providing timely updates and coordinating mobilization efforts in response to harmful state legislation that threatens access to WIC services. And that is the end of our presentation. So we wanted to give enough time for folks to ask questions, and we really appreciate people joining. I'm going to go ahead and stop sharing my screen and rejoin folks and see if there's any questions in the chat.